Hello, and welcome. You are not here for sympathy. You are here because your sleep is broken and you want to understand why. And that is exactly what today is going to deliver. Because here is what most people over 60 have never been told. The sleep problems keeping you awake tonight are not simply the result of getting older. They have specific causes. And those causes have specific solutions. But most advice seniors receive about sleep is either too vague to act on or aimed at a body 20 years younger. Today, we are counting down 7 things that may be actively destroying your sleep quality after 60. Not general wellness advice, specific, identifiable culprits that research has linked to broken sleep in older adults, each with a practical, concrete action you can take. The National Sleep Foundation, the NIH, the Mayo Clinic, and the American College of Physicians have all weighed in on these. And when we reach number 1, you will discover the sleep disorder present in roughly half of all men and a quarter of all women over 60. A condition responsible for some of the most serious health consequences in older adults, and one that is missed in an estimated 80 to 90% of the people who have it, because every single symptom looks exactly like something they already expect from aging. Before we begin, drop your age and where you are watching from in the comments below. We read every single one. Now let us start with number 7. Number 7, your body clock has shifted and nobody told you. Number 7 is something that happens to every person over 60, though almost nobody explains why. You find yourself falling asleep earlier in the evening than you used to, and waking earlier in the morning than you want to. Not necessarily rested, just awake. At 4:30, at 5, while the rest of the world has not started yet. This is not insomnia in the traditional sense. It is something researchers call an advanced sleep phase, and it has a specific biological cause. Here is the mechanism. Deep inside the brain sits a cluster of cells called the suprachiasmatic nucleus, the body's master clock. In younger adults, it drives a well-timed rhythm of melatonin at night and cortisol in the morning. But after 60, 2 things happen simultaneously. The suprachiasmatic nucleus begins to deteriorate, and its signals weaken. And the pineal gland, which produces melatonin, begins to calcify and produce less of it. Nighttime melatonin levels in older adults may be only twice their daytime levels, compared to 8 to 10 times in young adults. The entire sleep-wake rhythm shifts earlier and loses its sharpness. You feel sleepy at 9 in the evening and alert at 5 in the morning, whether you want to or not. What you can do right now. The single most effective tool for pushing the body clock later is bright light exposure in the late afternoon and early evening. Aim for 30 minutes of natural outdoor light between 4 and 7 in the afternoon. If natural light is not available, a light therapy box used for 20 to 30 minutes in that window can produce meaningful shifts. Avoid bright light early in the morning, which reinforces the early wake pattern. Keep curtains drawn on waking until you are ready to start the day. Keep your wake time consistent, even on weekends. The body clock anchors to a fixed wake time more reliably than to a fixed bedtime. Shifting it gradually, by 15 minutes later every few days, can reset the rhythm over several weeks. Safety note: early morning awakening combined with persistently low mood deserves a conversation with your doctor, as it can also be a sign of depression in older adults. Number 6, restless legs syndrome. Number 6 affects roughly 1 in 10 older adults and is so consistently dismissed that in one documented study, only 9 out of 103 people who met the clinical criteria for it had ever been diagnosed. Restless leg syndrome. The name sounds minor. The experience is anything but. When you lie down at night or sit still for extended periods, an irresistible urge to move the legs arises, often described as a creeping, crawling, tingling, or deep pulling sensation. It is temporarily relieved by movement, and it returns the moment you stop. The result is that falling asleep becomes a battle, and staying asleep can become impossible. The mechanism is neurological. Research has linked restless leg syndrome to how the brain handles iron and regulates the dopamine system. When iron availability in the brain is low, dopamine pathways that control movement and sensation become dysregulated. This is why one of the most effective and frequently overlooked treatments is not a medication at all. It is iron. Why do seniors dismiss this? Because the sensation is vague and hard to describe, and many people assume lying awake with uncomfortable legs is simply part of getting older. What you can do right now, at your next appointment, ask specifically for a serum ferritin blood test. Ferritin measures iron stores in the body. Many people with restless leg syndrome have ferritin levels within the standard normal range, but still low enough to contribute to symptoms. Many specialists recommend a ferritin level above 50 micrograms per liter for people with this condition. If your level is low, iron supplementation under medical supervision may significantly reduce or resolve the symptoms. Also, ask your pharmacist to review any medications you take. Certain antihistamines, some antidepressants, and medications that block dopamine can worsen restless leg syndrome significantly. Caffeine and alcohol in the evening are also well-documented aggravating factors. If you are finding this video helpful, please take a moment to like it, subscribe, and hit the notification bell. Number 5 is a culprit that wakes many seniors in the night without them ever realizing what caused it. Number 5, acid reflux and heartburn at night. Number 5 is one that many seniors experience but almost never connect to their disrupted sleep: nighttime acid reflux. And the reason it belongs here is not just because it wakes people up with discomfort. It is because in many older adults, it causes what researchers call silent reflux. Acid that rises during sleep causes microarousals and fragments the night without the person ever feeling the burning sensation they might recognize as heartburn. Here is why lying down makes reflux so much worse. During the day, gravity keeps stomach contents where they belong, and swallowing regularly clears any acid that rises. At night, both defenses disappear. You are horizontal. Swallowing drops to almost nothing. Saliva production, which neutralizes acid, falls dramatically during sleep. The result is that acid can sit in the esophagus for far longer than during the day, irritating the lining and triggering enough disruption to fragment sleep significantly without ever waking you fully. Research has found that GERD patients experience substantially more prolonged acid exposure during recumbency than during waking hours, and that this nighttime pattern is closely linked to poor sleep quality. After 60, the muscle at the base of the esophagus that acts as a valve loses some of its tone, making nighttime reflux more likely and more prolonged than in younger adults. What you can do right now: elevate the head of the bed by 6 to 8 inches using blocks placed under the legs at the head of the bed or a wedge pillow placed under the mattress. Extra pillows under the head alone tend to bend the body at the waist and can worsen reflux rather than help it. Sleep on your left side when possible. The anatomical position of the stomach relative to the esophagus makes left side sleeping more protective. Stop eating at least 3 hours before lying down. Reduce or avoid common evening triggers, including coffee, alcohol, chocolate, tomato-based foods, and anything fatty or fried. If symptoms persist despite these changes, speak to your doctor about whether a trial of acid-reducing medication is appropriate. Number 4, chronic pain and the cycle it creates. Number 4 is one that most people living with it have simply accepted as the price of getting older: arthritis, joint pain, neuropathy, back pain, the aching that worsens when there's nothing to distract from it. And in the quiet of the night, there is nothing to distract from it at all. But here is the dimension most people do not realize. The relationship between pain and sleep is not one directional. It is a cycle. Pain fragments sleep. But disrupted sleep also does something measurable to pain perception. Research has found that sleep deprivation lowers the pain threshold significantly. In studies where healthy adults were kept awake, their sensitivity to pain increased substantially after even partial sleep restriction. In an older adult with existing joint or nerve pain, each night of poor sleep makes the following night harder. The pain wakes them. The disrupted sleep makes the pain worse. The worse pain makes the following sleep worse again. The inflammation that drives many forms of chronic pain also directly interferes with sleep architecture, reducing deep sleep and increasing the number of arousals across the night. what you can do right now. Speak to your doctor specifically about the timing of any pain medications you take. If you take pain relief once daily, ask whether the dosing schedule could be adjusted so that coverage is strongest during the nighttime hours when pain most disrupts sleep. Taking an appropriate pain reliever 30 to 45 minutes before bed, rather than in the morning, can make a meaningful difference. For joint pain, gentle heat applied to the most painful areas for 15 minutes before bed relaxes surrounding muscles and reduces the intensity of discomfort during the first hours of sleep. A warm bath or shower an hour before bed has the added benefit of lowering core body temperature as you cool down afterward, which is a natural signal to the brain that sleep time is approaching. Gentle movement during the day tends to reduce inflammatory pain more reliably over time than rest. Even a short daily walk helps maintain joint mobility and reduces the stiffness that intensifies overnight. Number 3, medications that are quietly disrupting your sleep. Number 3 is the one on this list with the most immediately actionable solution, because the problem is often not a disease or a condition, it is a pill. One prescribed for a completely different reason, one that has been quietly disrupting sleep for months or years without anyone making the connection. Harvard Health has published guidance on this directly, noting that certain commonly prescribed medications can suppress the body's natural production of melatonin, increase nighttime arousal, or cause nocturia that repeatedly breaks sleep. A review published in the Mayo Clinic proceedings identified several classes of medication as significant disruptors of sleep quality in older adults. Here is the most important mechanism. Beta blockers, widely prescribed for high blood pressure and heart conditions, work in part by blocking adrenaline, but they also suppress melatonin production by the pineal gland. Melatonin is the hormone that signals the brain that darkness has fallen and sleep should begin. When beta blockers reduce its production, the brain receives a weaker sleep signal. The result is difficulty falling asleep, lighter sleep, more nocturnal awakenings, and sometimes vivid dreams or nightmares. Other common culprits include certain stimulating antidepressants, corticosteroids taken in the evening, decongestants, and diuretics that drive repeated bathroom visits through the night. I recall a gentleman named George, in his early 70s, who had been complaining of broken sleep for over a year. When he finally brought all his medication bottles to a pharmacist for review, the pharmacist identified 2 problems. His beta blocker was being taken at night, and his diuretic was also taken in the evening. Both were moved to the morning with his doctor's agreement. Within 3 weeks, George reported sleeping through the night for the first time in over a year. He said the change felt almost too simple to be real. What you can do right now, write down every medication and supplement you take, including the time of day you take each one. Book a medication review with your pharmacist and ask specifically whether any of them are known to affect sleep and whether timing could be adjusted. Ask particularly about beta blockers, diuretics, corticosteroids, and anything containing stimulants or decongestants. Do not change medication timing on your own without first confirming with your prescribing doctor. Number 2, waking in the night to urinate. Number 2 is the most frequently reported sleep disruptor in older adults. Waking in the night to use the bathroom. 2, 3, sometimes 4 times. A disrupted night that has become so constant, it barely registers as a problem anymore. Just the way things are. But here is why it belongs at number 2, rather than being accepted as an inevitable fact of age. For many seniors, the urination is not the underlying problem. It is the symptom of something that, once identified and addressed, can significantly reduce those nightly interruptions. Here is the mechanism. Nighttime urination in older adults is driven by several overlapping causes. First, a hormonal shift causes the kidneys to produce more urine at night than during the day. Second, fluid retained in the legs during sitting redistributes into the circulation when you lie down. The kidneys process it, and the result is a significant increase in urine production in the first hours of sleep. Third, the bladder becomes less elastic with age and holds less comfortably. Fourth, underlying conditions, including heart disease, kidney disease, and poorly controlled blood sugar can all drive significant increases in nighttime urine production. Research published in Sleep Medicine found that nocturia was the most commonly cited cause of disturbed sleep in older adults by a significant margin. Over half of adults aged 55 to 84 named it as the cause of their broken nights, more than 4 times more often than pain, which was the next most common answer. What you can do right now. Front-load fluid consumption earlier in the day. Aim to consume the majority of fluids before 3 in the afternoon and limit intake significantly in the 2 hours before bed. Avoid caffeine and alcohol after midday, as both increase urine production significantly. If you take a diuretic medication, ask your doctor whether it can be moved to the morning so its effects occur during waking hours. During the late afternoon, elevate your legs for 30 minutes. If possible, wear compression stockings during the day. This reduces fluid accumulation in the lower legs, meaning less fluid to be processed by the kidneys when you lie down at night. Install motion-activated lights along the path to the bathroom to reduce fall risk on those trips that do occur. If nocturia persists despite these changes, ask your doctor to rule out contributing conditions, including blood sugar control, heart function, kidney function, and prostate issues in men. Now, let us reach number 1. The most common serious sleep disorder in older adults, and the one almost no one knows they have. Number 1, untreated sleep apnea. After 6 sleep destroyers with practical, actionable fixes, number 1 is the most urgent, the most damaging, and the most consistently missed: obstructive sleep apnea. And the reason it sits at the top of this countdown is not just because it is common. It is because every single symptom it produces looks exactly like what most older adults already expect from getting older. Here is what happens during a night with untreated sleep apnea. As you fall asleep, the muscles of the throat relax. In someone with this condition, they relax far enough that the airway partially or fully collapses. Breathing stops. Oxygen levels in the blood drop. The brain detects the shortage and triggers an emergency micro-awakening just long enough to restore breathing, but not long enough to remember. This cycle repeats dozens of times, hundreds of times in severe cases. Each time, the brain is yanked out of restorative sleep. Each time, oxygen drops and recovers. Each time, the sympathetic nervous system surges. The research on what this does to an aging body is serious. Repeated drops in oxygen trigger inflammation in blood vessel walls, activate hormonal systems that raise blood pressure, and disrupt the glucose regulation that occurs during deep sleep. Research and American Heart Association guidance both identify untreated sleep apnea as a direct contributor to treatment-resistant high blood pressure, coronary artery disease, stroke, and accelerated cognitive decline. A study of older men found that nocturnal oxygen drops from sleep apnea independently predicted falls and fractures, adding to the risks of an already vulnerable population. And yet, the vast majority of people who have it have no idea. Estimates suggest 80 to 90% of significant sleep apnea remains undiagnosed. A large population study using objective measurements found moderate to severe sleep apnea in roughly 50% of older men and 23% of older women. And in older adults, the classic signs of loud snoring and witness gasping are often less prominent. Instead, the person notices fatigue that does not improve with more time in bed, waking unrefreshed, memory problems, and morning headaches, all easily attributed to age. What you can do right now. Ask yourself, and ask anyone who sleeps near you, these specific questions. Do you snore? Has anyone seen you stop breathing or gasp during sleep? Do you wake frequently feeling as though you never fell deeply asleep? If the answer to any of these is yes, ask your doctor for a sleep study. In most cases, this is now available as an at-home test using a small device that monitors breathing, oxygen levels, and heart rate overnight. It is non-invasive and can be life-changing in what it reveals. If sleep apnea is diagnosed, CPAP therapy delivers gentle air pressure through a mask to keep the airway open. Modern machines are smaller and quieter than older versions, and most people using them consistently report a dramatic improvement in sleep quality, daytime energy, and mental clarity within the first few weeks. Tonight, try sleeping on your side rather than your back. Back sleeping allows the tongue and soft tissues to fall backward into the airway more easily. Side sleeping alone can reduce breathing interruptions significantly in position-dependent cases. A simple way to encourage this is to sew a tennis ball into the back of your pajama top, making back sleeping uncomfortable enough that the body naturally stays on its side through the night. Do not accept unrefreshing sleep and morning fatigue as unavoidable parts of aging. For a significant proportion of older adults, it is not aging, it is an airway. And an airway is something that can be treated. Here's what today's countdown tells us. Broken sleep after 60 is not a single problem with a single cause. It is a list of specific, identifiable, and largely treatable culprits that most seniors are carrying around without knowing their names. 7 things that may be destroying your sleep. 7 solutions you now know exist. Your body clock has shifted earlier and needs light in the late afternoon to help reset it. Restless leg syndrome affects 1 in 10 older adults and responds dramatically to something as simple as an iron check. Nighttime acid reflux silently fragments sleep without you ever feeling the heartburn. And elevating the head of the bed can begin to change that tonight. Chronic pain and disrupted sleep fuel each other in a cycle, and the timing of pain medication matters more than most people are told. A medication prescribed for your heart or blood pressure may be quietly suppressing the hormone that tells your brain it is time to sleep, and moving it to the morning may change everything. Nocturia is the most commonly reported sleep disruptor in this age group, and it has causes, not just explanations. And sleep apnea, invisible to the person who has it, is silently working against the heart, the brain, and the balance of older adults in numbers that most people would find astonishing. The American College of Physicians has been clear on one more thing worth knowing. For genuine insomnia in older adults, the treatment with the strongest evidence is not a sleeping pill. It is a structured approach called cognitive behavioral therapy for insomnia. It addresses the thoughts and habits that perpetuate broken sleep. It has been shown to work specifically in older adults, and it produces changes that last. If your sleep has been broken for more than 3 months and is affecting your daily life, ask your doctor for a referral. Which of these 7 was most relevant to you? Leave it in the comments. We read every single one. If you found this video helpful, please like, subscribe, and hit the notification bell so you never miss the next one. And share this with someone you love who is over 60 and struggling with sleep. A night of genuinely restorative sleep changes everything that follows it. Thank you for watching, and we will see you in the next video.